Up first this evening, there's a dengue outbreak. Health Minister Dr. Christopher Tufton this afternoon confirmed that the country is currently experiencing a dengue outbreak.
Dr. Tufton says $250 million has now been set aside to deal with the crisis. TVJ Shamela Pullen attended the press conference and now reports.
It has passed for the month of December based on the numbers.
Just for somebody who's on this review?
Yes, it has reached the outbreak threshold, yes.
At an emergency press conference at the Health Ministry in St. Andrew Thursday, Health Minister Dr. Christopher Tufton says last year there were 7 dengue-related deaths, but only 2 have been confirmed. In December, 123 cases of dengue were recorded. The total includes suspected, presumed, and confirmed cases. Dr. Tufton says the number surpasses the outbreak threshold, which is 96.
Of 96 cases, so 96 cases for the month of December, and in this case, this last December, we had 123. This is the first month in the 2018 calendar in which the number of cases exceeded the outbreak threshold. As of today, 830 reported cases have been classified as suspected, presumed, or confirmed cases. The number of confirmed cases of dengue stands currently at 23.
Chief Medical Officer Dr. Jacqueline Bisesa Mackenzie says Kingston and St. Andrew recorded the highest number of dengue cases.
We have had an enhanced surveillance program going on, especially since we've been in the dengue season, and this means that we have daily updating of our numbers. So the cases coming on a daily basis, and they are assessed to see if they meet the case definition. So as of this morning, based on the updating of cases up to last night, we can say that we have passed the level.
Dr. Tufton says there will be extended opening hours at specific healthcare facility until 8 p.m. for persons who have symptoms of the dengue.
Kingston and St. Andrew, the Stony Hill Health Center, the Olympic Gardens Health Center, Glen Vincent Health Center, and Slipen Road Comprehensive Health Center. In St. Thomas, Morant Bay Health Center, in St. Catherine, St. Jago Park Health Center, and Greater Portmore Health Centers, St. Anne, St. Anne's Bay, in St. Mary, Onato Bay, Highgate, Oracabessa, and Gale, in Manchester, Mandeville Regional, Spalding, and Clarendon, in Clarendon, Maypen Health Centers, in St. James, Montego Bay Type 5, and in Westmoreland, the Savlamar Health Center.
Over 300 communities are considered vulnerable. Dr. Tufton says an additional $250 million will be allocated to support some of the enhanced measures to prevent dengue.
But in the particularly vulnerable communities, we intend to engage and privately contract private sector players who have the capability and who are in that line of business. We also are intending on hiring another 500 vector control aides. We have 500 currently in the system. We're going to double those numbers in collaboration with the HOPE program, again to create greater presence on the ground.
Shamela Pullen, TVJ News.